Okay, so this is going to be Taurus Z. They say I'm old-fashioned and live in the past, but sometimes I think progress is too fast. Temperature. This is going to be from pages 226 to 233. Normal ranges are as follows. You've got your oral temperature range, which is 97.6 to 99.6. The rectal temperature, which is 98.6 to 100.6. The axillary, which is 96.6 to 98.6. The tympanic, which is 96.6 to 99.7. And the temporal, which is 97.2 to 100.1. It's important to know the range for each route to be able to properly report abnormalities, because an example here would be a temperature of 100.4 may be an abnormal for some routes and within the normal range for another. You want to make sure you ask the patient if they've had food or drink in the last 15 minutes, and if so, you want to choose another route. So what should be reported, and that would be anything that's outside the normal range for that route. So for pulse, the normal range is 60 to 100 BPM, which stands for beats per minute in adults. You ask about your prior activity. That's going to affect their pulse rate if they were sleeping or if they were walking. Whatever it is that they were doing right before you check that pulse is going to have an effect on it. It's usually taken on the radial or apical site, and you want to make sure that you can name all the pulse sites and their locations. And what if there's no pulse in a limb, but there is a pulse elsewhere? That's important to note and make sure that you report that immediately as well, because that could be a sign of a blood clot or any number of other things could be going on to cause that abnormality. But that is an abnormality that needs to be reported immediately. What if there's no pulse at all? Well, you need to get some help immediately, and you need to make sure somebody knows about it as soon as possible. Depending on whether or not you are trained in CPR would depend on your next step for that, as well as your facility's policy on what you would need to do next. But for sure, somebody needs to know immediately if there's not a pulse. So this is the pulse oximetry. It's used to measure your oxygen saturation, and a lot of these also have the capability to measure the pulse as well. And it displays them usually digitally right there on the front of that screen. There are other versions of this that will connect to a different machine and display it somewhere else. This is a portable one. So you count your pulses by hand. You do not want to use your thumb to count another person's pulse. Keep your pressure even and use the watch with the second hand. Of course, you would want to count it for the full minute if possible. Especially with irregular heart rates, you may not get an accurate reading if your heart rate's irregular and you don't count it for the full minute. So terms to remember, let's break these down a little bit. So you've got your prefix tachy, which means fast, and then you have cardia, which would be related to the heart. So that word would be fast heart or fast heart rate. And then you have brady, which would mean slow. Then you have slow heart rate for bradycardia. Next, you have asystole, and A is without. Systole is the word that we use to describe the contraction phase of the heart in anatomy. So asystole, without contraction, the heart's not beating. Then you have atrial fibrillation. What I want you guys to remember is not necessarily what it means. What I want you to remember is if you have a patient that has atrial fibrillation, when you're going in to check their heart rate, you need to make sure you're counting it and not relying on a digital readout, just for accuracy's sake. Common pulse sites. So you have your temporal pulse at the top there. You have your carotid pulse next. You have your apical pulse, which is the one above the heart. You have the brachial. You have the radial and the ulnar. Please pay attention to which side those are on, because when you take your pulse, you're going to use your radial side. Then you have the femoral area, popliteal, posterior tibial, and dorsalis pedis. Respirations, the normal range for adults is 12 to 20 respirations per minute. It should be consistent in both depth and spacing between their breaths. And you do not want to make it obvious you're counting the respirations because it could be influenced not only by activity, but just by the fact that they know somebody's counting them. People may breathe faster or slower. And what should you report? That would, of course, be any abnormalities. Types of respirations, you're going to have apnea, which is without, dyspnea, which would be trouble, eupnea, that U at the prefix there means normal, orthopnea would be related to the position, difficulty breathing when laying down. Tachypnea, tachy again means fast, so that's going to be fast breathing. And then Cheney-Stokes respirations. When counting respirations, you'll leave your fingers in the position that you counted the pulse and do not tell the patient when you begin counting because they may breathe faster or slower. Blood pressure, you have your systolic, which is the top number. You can remember that by Guy. They both start with S. You have diastolic, which is the bottom number. Think of down. Again, those both start with D. Your normal systolic for adults is 100 to 119. And your normal diastolic for adults is 60 to 79. Low would be below 100 or below 60, and high would be above 140 or above 90. Now, prehypertensive would be anything between those ranges, such as 120 to 139, 80 to 89. That would be considered prehypertensive. It's not necessarily high yet, but it is headed that direction because it is outside the normal range. Blood pressure is very important. You, of course, want to report immediate abnormalities or changes. If you've had a patient that has been abnormal for the past 3 weeks and all of a sudden they're within the normal range, something's not right. Or their medication may have kicked in if they've been put on new medicine. Either way, that's something that the nurse needs to know about so that it can be documented so that when the physicians come in and they decide to make medication changes, they can look back and see, is it working? Is it not working? What do we need to change? And you also want to include stuff such as if their blood pressure has been normal all of a sudden, it's not normal anymore. That would be something that you would need to report immediately. Something might be causing them to have abnormal blood pressures. Too low or too high is life-threatening. A lot of people think of too high, they think of stroke. But if you think of low blood pressure, you're not getting the perfusion that you need. You're not getting the blood that you need through all of your tissues in your body. So low can be dangerous too. They can both be life-threatening. Just remember, time is muscle, time is brain cells. You do not want to be the one responsible for someone losing any of that. So if you notice any abnormalities, please, please, please report those as soon as possible. That doesn't mean finish all your patient's vitals and then go report all the abnormalities at one time. That might save you some walking. It might save you some time, but you might be saving yourself, but you're costing somebody else. And you don't want to be the one responsible for somebody else's life when it comes to blood pressure and vital signs. If you receive an abnormality on an electronic machine, you want to take a manual cuff to ensure accuracy if you have one readily available. If you do not have a manual cuff right on hand, do not waste time trying to find one. Just go ahead and notify the nurse immediately. So terms to remember here would be hypertension, which is hyper, high, fast. And then you have hypotension and slow. So you would think of low, slow, hypo. They all have an O. Orthostatic hypotension. That orthostatic, again, has to refer to position. So that would be when they go from a sitting or laying position to a standing, then it gets hypotensive or hypertensive there. Blood pressure may be taken manually or with an automatic cuff. On the left there, that blue is called a Dynomap, and that's one of the automatic cuffs. And then, of course, on the right, the black there is considered your manual cuff. Okay, so oxygen saturation should be above 93%. If not, it should be reported immediately. And you want to document if the patient's already on oxygen and the type of amount of oxygen and the saturation. If the patient's lying down, the saturation is low. If it's not against the patient's care plan, then you would want to sit them up because gravity may help expand the patient's lungs. However, there are some conditions where you cannot sit the patient up, and it actually would be dangerous for them. So please make sure that you do check the care plan before you do that. Pulse oximeter, these are the different kinds that I mentioned earlier. You have the one down there in the bottom left, which we've already looked at. Then you have the one on the top left. It's portable also, but it is one that's connected differently. It's not wireless, it's just a portable version. You have the one in the middle there. Those are the wraparound versions. And then the one on the bottom right is also another type of wraparound. Pain, if there's any abnormalities present, ask about them as well as the pain. If the patient reports pain, even if you don't ask them, make sure that you report it immediately. And if there's any activities along with the vitals, that they may alter the vital signs, such as if the patient was just up with physical therapy right before you came in. There are your references. There's some more references. And there's some more. Of course, your information did come from your textbook, and then the photos came from all these references listed here.